for a week 13 pregnancy update. We are 13 weeks, 1 day, something like that. It's another car vlog because Oz and I are once again going to Nashville with Brianna for the week. Originally we were not supposed to go, then kind of at the last minute she was like, you know what, I'm only going to be gone like 3 days or 2 days, why don't everybody just let up and go. Although, yes baby, although when I just talked to her a while ago, as we're on our way to her house to go, did you undo that? No. She said she was starting to freak out because nothing's done on her end. I mean, Oz and I packed very quickly, and anyways, going with 20 bucks in our pocket, that's the life I live. Woo, woo, woo. Anyways, but we did fine last week. We mostly, we only ate out once the whole time we were gone, and we did a lot of picnicking, and yeah, it all worked out. So that's what we're doing again this week. I was actually up a pound and you know how I was up a pound and then I lost a pound, and now I'm back up a pound, like 1 point something, I don't know. I did never do the actual math, and it doesn't matter. I still feel good that I'm in this just kind of maintaining and only having like a gain of like 3 or 4 pounds. I'm fine about that. I feel good about that. My energy level has been back up this past week, so I'm very thankful for that. But my chest and back pain are back, and it's just the strangest thing, and I cannot pinpoint it. There's all these ifs, ands, and buts about it. At the end of the day, I honestly feel like it has something to do with the reflux hiatal hernia, possibly this vagus nerve. I don't know if I ever talked to you guys about that. Do you guys know anything about, I think it's vagus. It's V-A-G-U-S nerve. Apparently it's a nerve that is in your back, but it runs really close to like your esophagus. I had a subscriber reach out to me and talk to me about it, and said that she had light band, and the actual light band was like putting pressure on the nerve, and once she got that removed, blah, 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 blah. And I was kind of like, I don't know. I mean, some of the stuff she was saying sounded very similar to the way I feel. But then I just kept thinking, you know, I don't know. My biggest holdup was, what would be the difference? Why would I be having an issue? But if the hiatal hernia is bulging, and it's a sliding one, so sometimes it bulges and sometimes it doesn't, and sometimes it bulges more than others. That would make sense why there would be pressure and pain. I don't know. I have not made the appointment. I did make Oz's ear, nose, and throat appointment to have a recheck on his ears. So next week my goal is to make an appointment for the gastro doctor. I'm fixing to be out of my prescription for the pantoprazole, and I kind of wouldn't mind seeing her since I'm pregnant, and to also ask her about this vagus nerve, and if she knows anything about it, and what she knows, and how she feels about it, and maybe if she thinks things are just being aggravated more with the pregnancy. I don't know. I feel really out of breath, and I don't know why. Anyways, I guess I am talking really fast. So I have also noticed this past week that my appetite has greatly reduced, and I feel like I'm getting fuller quicker. Again, we did a lot of picnic things, so there was a lot of shared peanut butter and jelly sandwiches. There was a lot of like snacking on celery and carrots and a handful of chips and goldfish, and I did have some decaf coffee this past week. I had some regular coffee this week. I had some soda, which, by the way, you guys know that was the one thing I have not turned back to in the last 5 years. I've had some soda, and it has been like 0 calories, 0 whatever, but I don't know. It's so funny. I keep telling everybody that this baby wants soda, potatoes, and any kind of awesome unflavorful carb. Why? I don't know. I've been trying really hard not to give into that. I did have like a treat of a cookie this past week, but otherwise I've really just been trying to just kind of budget eat. And so anyways, but I don't know, my stomach just hasn't been right. Just have not felt as hungry. The last couple weeks before that, my hunger had to come back and I was feeling better about eating, but I don't know, I just have not been as hungry. I haven't been nauseous or anything. I just haven't been hungry. So there's that. But otherwise, I mean, besides the neck and the back pain, the back and the chest pain, things are okay. And again, the same as with the last pregnancy. I mean, every time there's a twinge of pain, or I feel weird, or I'm just like, what's that? Is it abnormal? Is it okay? Is everything fine? I forgot that you are constantly, you know, just checking yourself. Again, in the front area, I just feel like I have a little pooch. And I'm in the car, so I can't show you that. Yeah. So, at week 14, I have a doctor's appointment. My doctor's appointment is on July the 5th. It should have been the 4th, but obviously it's a holiday and they're closed, so I go July the 5th in the afternoon. And that'll be week 14. I go once a month. I don't know if your doctors are the same, but we go once a month till like this, I don't even know when. The middle of the 3rd trimester, and then you go every 2 weeks or something like that. I don't know, unless there's an issue or a problem. Also with my doctor, and we've not talked about this, and if this cuts off, no worries, I'll make a different video later, because I pretty much said everything I needed to say. She is good about, so she didn't feel like I was a high risk with my first pregnancy. I wasn't high risk just because I was a weight loss surgery patient. I know that sometimes happens. That has not been the case with my doctor. Also, she does not feel like I'm high risk because of my age. She has not even discussed my age at all with me, and she is well aware of how old I am. She was an older mom. I think she had her last kid when she was like 42, and I know that for a lot of doctor's offices in our area, although she's the only one in my town, but in our area, they make you see like a specialist one time if you're 35 or older, just one time, and they rule out they do run a bunch of tests. If everything comes out fine and clear, they release you and you don't have to go back unless you're having issues. She does not do that. You know, she just feels like that age is not always a big huge worry or a factor, only if, you know, you have health issues or there's something else going on. So right now, I feel pretty good about that. I am currently trying to decide if we're going to spend the money for a 3D 4D ultrasound. We did that with Oz, and I loved being able to have that. You know, money's tighter this time, so I know it's not a necessity, but it would be nice to do that and maybe find out a little earlier what we're having, and also just have those pictures. I feel bad to not have that with this one when I have it, you know, if I had it with Oz. But there'll be a lot of things that I have been feeling guilty about not having with the new baby. And I think I've already talked about this once, but, you know, financially we're just in a different position. And I know at the end of the day, the real true thing that the baby is ever going to need is going to be love. I know that. And obviously food and water and milk. But I just have all this guilt surrounding, you know, if it's a girl, there will be more new things because we don't have any girl things. And there will be some boy things that, or, you know, things that we had for Oz that can transition to this if it's a girl. If it's a boy, he will have no new things hardly. And, because we have all the stuff, which will be great. But I don't know. I just don't know. I don't know what it's going to be. And there are things like even stupid stuff like, you know, with Oz, I got new pajamas and I got a new robe, and, you know, I was making sure I had everything just perfect in my diaper bag. And I mean, I know we're far from that, or my hospital bag. I know we're a while before that kind of stuff has to even be thought about. But I was always thinking and planning and buying and getting stuff on sale. And, you know, I know we're still pretty new into this, but I feel guilty that I'm not even gonna be able to do those things. And again, at the end of the day, it doesn't matter. And I overpacked for the hospital, and there were lots of things that I packed in my bag that we didn't even use or need. And I don't know. There's a lot of guilt for stuff like that, and I don't know why, because at the end of the day, it doesn't matter. And I guess that's some of the pregnancy anxiety, maybe. I don't know. I don't know know why I feel that way. So, okay guys, that's it for week